So what is a balanced versus unbalanced solution and why? Sodium chloride 0.9% is considered unbalanced, while LR, plasmolite, and half normal saline with bicarb is considered balanced. Just wanted to share this table from UpToDate because it gives a good breakdown of the contents within each of these solutions. So to understand this a little bit better, we have to go back to our acid-base chemistry from Chemistry 101 and from nursing school. So if you remember correctly, there are a lot of electrolyte shifts that happen within the body. When you just have sodium chloride and you have one anion and one cation floating around in that solution, that's one option for the body to shift with. When you give something like lactate ringers or plasmolite or even sodium chloride with the bicarb, that gives more electrolytes, more options to help replace some of these shifts that end up happening when you're administering these fluids. So when is it appropriate to use an unbalanced solution? Pretty much whenever you want. There are considerations of when not to use it, but first let's talk about the advantages. It's cheap, $2 a bag, easy access, gets the job done, fills the space, and in certain conditions, you need to replace sodium. For example, DKA. You're going to replace fluid with normal saline for the first couple of liters because you need to replete their sodium and help manage some of the shifts that are going on associated with that acidemia. You do end up switching over because a main concern with, and here's one of the disadvantages, if somebody is on normal saline 0.9% for too long, they will go into hyperchloremic metabolic acidosis, and then you're pretty much just chasing your tail. How many patients have we had in the hospital for months at a time that get random fluid boluses here and there? That might be a patient that you, obviously looking at the whole picture, you may want to consider, hey, how much saline has this person gotten since admission? And is this contributing to their overall illness if they're acidotic? So basically, buffered solutions came around to help stabilize the fluids you're administering to patients. So for example, when you look at LR, it has lactate in it. Lactate converts into bicarb when it goes into the body, which bicarb plus acid equals neutralization. So that's the main goal of that. Not to mention it is slightly more close to serum blood concentrations than normal saline. But looking at the contents of the fluid itself, there's a couple considerations to take into account. First of all, this contains potassium, so you really want to be cautious in your renal patients so that you avoid hyperkalemia. And then secondly, there is not as much sodium or chloride in this, so you also have to monitor for hyponatremia. So plasmolite is pretty fancy. It's the most expensive solution, and it's the most balanced solution, and it is also closest to serum plasma. So why is that? So basically, I just want to note that there is no evidence that supports that plasmolite is better than LR or vice versa. And furthermore, there's no evidence to support that balanced solutions versus unbalanced solutions affect the incidence of AKI in ICU patients. And I just want to highlight that because they are more expensive, and it's good to keep in mind. And there are a lot of studies that cite that they're beneficial for that situation, but they're actually not. So when it comes down to making a decision, you have to look at the contents within the solution. Main thing with plasmolite is that it uses magnesium instead of calcium, so you have to consider that when you're looking at your patients. Renal, it has more potassium as well, so this might not be a good solution for renal patients. Furthermore, myasthenia gravis patients, they cannot tolerate magnesium, so it's important to know that that is in there. And then lastly, for this solution, I guess if in my practice where I've seen it used and where I would use it, knowing that it's not evidence-based necessarily, is that if I have a heart failure patient, I'm going to choose the least hypotonic solution. So if plasmolite is the least hypotonic solution and more effective at keeping the volume intravascularly and not in the third space where it creates problems, that's what I'm going to use. But I'm going to consider all of those other things that I discussed here.